Meet Dr. Matt Vaughan, our head of internal medicine, and one of the only veterinarians in the region trained in extracorporeal therapies for pets.
I'm Dr. Matt Vaughan. I am an internal medicine specialist here at VRCCO. There's three major categories for extracorporeal therapies. One would be kidney disease, and most often in veterinary medicine we're talking about acute kidney injury. So something that happened acutely to a kidney that created injury to where the kidney isn't able to function. And so in that process, the blood is moved through the dialysis machine, which acts as basically as an artificial kidney or an external kidney, so we can support those patients while their kidneys heal. The second group of patients would be toxicities, where we need to remove, maybe they ingested something like ibuprofen, and we need to remove that from the blood before it starts to create some organ damage. So with that, we filter the blood through a filtration system to remove the toxin and then replace the blood to the patient. The third group of cases are autoimmune disorders, where we might need to remove certain things within the blood that are called immunoglobulins, where they're bigger proteins, and we can remove those along with the patient's plasma, which is a component of the blood, and then with donated plasma from our donation or blood bank, we can replenish that plasma with what we call clean plasma. Most toxins are a one-time treatment. That might be anywhere from 2 to 4 hours on average. With the treatment, we have to place a large catheter in the jugular vein in the neck, which we have to sedate them a little bit for placement of the catheter. And then during the treatment, it's about 2 to 4 hours of filtration of the blood. It does depend a little bit on the toxin and the amount ingested. For kidney disease, it's very different. With those dogs, we need to correct their blood very gradually over a few days. So it's usually a treatment once a day for about 3 days, and then we move to 3 times a week. And the duration of time we need to treat a patient with kidney injury varies depending on if their kidney is able to recover and how quickly it's going to recover. We don't put every dog that has a kidney injury on dialysis. So the ones that we put on dialysis are ones that their kidneys aren't able to make urine anymore, so they're starting to accumulate fluid in their body, or their other organs are starting to fail because of how high their kidney values are on their lab work. And so it's only the very sick kidney patients that we consider starting dialysis for. So without dialysis, historically, those patients would be facing a decision of euthanasia. Keeping pets comfortable during a dialysis treatment or a toxicity removal is usually pretty easy. It's not painful. It does make them a little bit sleepy, which is to our benefit, so many just take a nap. One thing that we do concern ourselves with a treatment is that patients can get cold. Part of their blood is outside of their body and being returned, and that is warmed, the blood, in the process to try to keep it as warm as possible. But we do have warming blankets as well. We call them bear huggers, where there's some warm air around them, and blankets to make sure that we keep them as warm as possible during treatment. I think it's important that we have this type of treatment available in Central Oregon because we've got a lot of pets here, a lot of families that would be willing to treat, and until now it wasn't available in the region. So we're one of the only places available in Oregon for this type of treatment, and in many cases it can be a life-saving treatment. And sometimes, especially with the toxicity, time is of the essence to get somewhere and get treated as soon as possible. So to have that available in Central Oregon for the families that are in Central Oregon is something that we wanted to be able to provide as we try to push the boundaries of the advanced treatments that we have available at VRCCO. It's also a great opportunity for pet parents that are not in Central Oregon, because some of these, especially the kidney disease patients, have time. They just may need to travel to us to be able to get the treatment done. So we've treated some dogs from other areas where they can stay with us in comfort while they start their treatment.